Diabetes by Kendall Overbeck. What is diabetes? Diabetes is a disease in which the body's ability to produce or respond to the hormone insulin is impaired, resulting in the abnormal metabolism of carbohydrates and elevated levels of glucose in the blood. Glucose comes from the foods you eat. Insulin is a hormone that helps the glucose get into your cells to give them energy. Over time, having too much glucose in your blood can cause health problems such as heart disease, nerve damage, eye problems, and kidney disease. What is the difference between the two types of diabetes? Type 2 diabetes represents about 90 to 95% of the cases and is more common in people in their 40s and beyond, in certain ethnic groups, and in those who are obese and sedentary. According to the American Diabetes Association, type 1 diabetes accounts for 5 to 10% of all diagnosed cases of diabetes. Each year, over 13,000 new cases of type 1 diabetes are diagnosed in children and teenagers, making it one of the most common chronic diseases in American children. People with type 1 diabetes do not produce insulin, a hormone that regulates how cells obtain energy from food. In type 2, the pancreas produces too little insulin, or the body is not able to properly use insulin that the body does produce. Diabetes is a major cause of heart disease, blindness, kidney disease, nerve damage, and other complications. So type 1, you are born with it, and type 2 is caused from an unhealthy lifestyle. What role do genetics play? If an immediate relative, like a parent, brother, sister, son, or daughter, has type 1 diabetes, one's risk of developing type 1 diabetes is 10 to 20 times the risk of the general population. Also, it is unclear why, but it is shown that Caucasians have a higher risk of type 1 diabetes than any other race. The type 2 occurrence of multiple cases in a family may reflect a shared environmental risk factors, such as obesity and sedentary lifestyle, and does not imply necessarily the sharing of a diabetes gene. Your risk of getting type 2 diabetes does not increase if a family member gets it, but there are exceptions from that statement. If a patient developed type 2 diabetes despite being lean, then the sibling's risk is about twice the general population risk. Or if the patient has a parent with type 2 diabetes, the sibling's risk is almost 3 times the general population risk. If both parents have type 2 diabetes, the sibling has nearly a 50% chance of developing diabetes as well. Negative impact on the body. Diabetes-related complications include damage to large and small blood vessels, which can lead to heart attack and stroke, and problems with the kidneys, eyes, feet, and nerves. However, the risk of most diabetes-related complications can be reduced through a healthy lifestyle, including exercise, weight control, and sticking to your meal plan, which can help control your diabetes. You should also monitor your blood glucose level and take medicine if prescribed. Who is most at risk for developing type 2 diabetes? Your chances of developing type 2 diabetes depend on a combination of risk factors, such as your genes and lifestyle. Although you can't change risk factors such as family history, age, or ethnicity, you can change lifestyle risk factors around eating, physical activity, and weight. These lifestyle changes can affect your chances of developing type 2 diabetes. You are more likely to develop type 2 diabetes if you are overweight or obese, have a family history of it, have high blood pressure, are not physically active, have depression, and have high levels of cholesterol. How do lifestyle choices affect the onset and impact of diabetes? Simply just knowing the risk factors for type 2 diabetes might help individuals delay or even prevent the disease. In fact, many lifestyle choices can reduce one's chance of developing type 2 diabetes. Of these lifestyle factors, obesity has the strongest association with diabetes. In addition, smoking hampers the body's ability to utilize insulin and affects the cells of the pancreas that produce insulin. By choosing to exercise, eat right, controlling your blood pressure, and not smoking, this will affect your chances of getting diabetes by lowering them or to help reverse type 2 diabetes. Sources.